King County is one step closer to securing a Capitol Hill site for the county's next crisis care center, despite public pushback. The unanimous committee vote sends the measure to the full council to consider. If approved, a $56 million crisis center is projected to open in 2027 near Broadway and Union. KOMO's Michelle Esteban joins us live. And Michelle, the council got an earful before this vote.
Yeah, they did indeed, Mary. But I'll tell you, the one thing that there's no disagreement about, we need a 24/7 facility here in the region, or we need another one. As you mentioned, this would be the second. But the questions that remain here are one of transparency, community engagement, and location.
How did you factor for the 4,000 school children, grades K through 12, within a mile of this facility?
I have many questions of how well it will do.
We urgently request a 90-day pause.
One by one, they asked King County Council members to hit the pause button on plans for a King County Crisis Care Center in Capitol Hill. Glenn Heimstra was one of them.
I'm certainly not saying no, but I am concerned about it being done in the right way. I do think actually other locations might be better.
With a vote.
Aye. The vote is 7 ayes, 0 noes.
The plan got one step closer to reality. Committee members advanced the proposal without recommendations to the full council. That means no final decision yet, and there's more to talk about. Exactly what a group of residents and business leaders in the neighborhood want. In fact, some accused the council recently of not being transparent or engaging enough with the community.
These crisis care centers, as we all have said, are desperately needed. And it's clear that we still need to do additional work.
Council members acknowledged the need for enhanced community engagement, insisted that community input would remain a priority throughout the project's development, and said so far they've done about 40 listening sessions.
Someone's ready to go to treatment. Help right away.
David Coffey with the Recovery Cafe testified in support of the center. It would provide walk-in behavioral health and substance use care to anyone, regardless of insurance status. And council members said it's what voters want. The Crisis Care Center initiative was approved by 73% of Seattle voters in 2023. And council members insist the need is urgent.
I think what you have is you have a system that's often disjointed, but here you have all those services on one site.
And I know we have our good chair.
One of those services also includes transportation, and that goes to some of the safety questions. Unlike a lot of other facilities, residents here would have transportation to and from the facility. Discharges are not likely to happen overnight. That's a big concern, even though it's a 24/7 facility. And there's a 4-point plan that the county and the city are working together on with police. That's the very latest. This will go to full council October 7th. And yes, there will be more opportunity for public input. I'm Michelle Esteban, KOMO News.
That brings us to our KOMO Pulse poll. How do you feel about building crisis care centers in local neighborhoods? Take a look at the live results coming in. 66% say they have public safety concerns. 25% concept is good, locations worry me. 8% say there is a critical need. If you'd like to weigh in, just scan that QR code. It'll take you directly to the story and the poll on KOMOnews.com.